Yeah, I will. And just a quick reminder for everybody who's participating today on the in the meeting to speak into the mic, to speak loudly. I am going to call your name and just confirm if you're in attendance. Shauna Janeway sitting in for Dave Sanders. Sitting in for Chad Bojo. Esteban.
Here. I'm sitting in for myself.
Thank you, Esteban. Tyrone Spears sitting in for Dana Brown.
Sure.
Matt Crawford sitting in for Matt Rudnick. Paul Gerard sitting in for Matt Zabo. And Petty Santos sitting in for Holly Walcott.
Okay.
That is 3 members labor, 4 members management.
Thank you. Do you have any public comments?
As a reminder for those who are participating via phone, if you could press *9 on your phone, put yourself in the queue. For anybody who's in attendance in the room, if you could bring your speaker card up to the front. Seeing none and hearing none.
Item in report to 38 on the wellness part of the
Brianna, are you connected?
Yes, I am.
Brianna, we can see you, but we don't hear you.
You can hear me?
Yeah, it has. There we go.
You can hear me now?
Yes,
Yes.
we can.
Oh, great. And just let me know when you would like me to start, please.
Go ahead.
Okay, good morning. Today I will be summarizing the key findings and recommendations for the wellness third-party administrator request for a proposal RFP for your consideration. Beginning with section A, the background. This provides a timeline associated with the procurement process, which commenced in April of this year. Moving quickly down to section B is RFP services overview. It is important to highlight some of the goals for LA Well, which include establishing a trusted brand for Live Well, leveraging existing service provider relationships for unified member support, and maintaining a performance measurement system, just to name a few. This section also outlines the current services being received, which include a dedicated account management team for day-to-day call center support, a web and mobile platform, and communication expertise. Again, just to name a few. Finally, this section describes the minimum qualifications for the responder, such as legal authorization to do business in California, 10 continuous years of relevant experience, absence of disbarment or suspension, and a gross annual revenue of at least $15 million. Moving on to section C, which describes our evaluation approach. The RFP included 115 questions across 18 categories with different weights, which you will see in the graph. Proposers responded to each question and were scored from a range from 1 to 5. A qualitative analysis was applied to all the sections except for fees and performance guarantees, which had a quantitative review. Section D will describe our analysis and scoring. The proposals were evaluated and scored by the review committee, which included myself, Daniel Powell, and Paul Makowski. Each proposal was also reviewed by the city's consultant, Siegel, as a peer review. A copy of the questionnaire and each proposer's answers are provided for reference in attachment A. Siegel evaluated bidders by the specified review criteria, assigning weighted scores to each section. Additionally, Siegel considered how well the bidders aligned with the Live Well's program core wellness principles. The resulting ranking had Virgin Pulse at the top, with WebMD as a contender. However, the city's review committee rating is the final score and determination. Overall, the review committee rated Virgin Plus proposal most highly. The committee scoring results for all proposals are shown in the chart on page 8. Section E, we'll be going over our analysis and scoring. Overall, the rating committee and consultants found that each proposal's answers met the standard of each category. Variance in scoring between proposals were minimal. However, we provided a summary highlighting sections with a slightly greater degree of variance. Under the section Web Platform and Mobile Apps, Virgin Plus and WebMD offer a registration process through integration files, which aligns with the city's current method. ShareCare and Sonic Boom provide alternate methods like custom URLs or single sign-ons. However, there's a concern that these methods may not effectively restrict registration to eligible members. To better understand their web platform, the city requested dummy account access. Unfortunately, ShareCare did not respond to this request. Sonic Boom, Virgin Plus, and WebMD all granted access and were evaluated, and was observed that each site was user-friendly and visually appealing. However, Virgin Plus and WebMD platforms stood out due to their flexibility and functionality. Under the HRA and biometric screening section, Virgin Pulse stood out for externally validating their questionnaire among the proposers. While the other firms didn't mention external validation, they provided detail about internal validation methods. Under wellness and lifestyle coaching, Virgin Plus, ShareCare, and Sonic Boom excelled in health coaching services, but Virgin Pulse mentioned specializing in 22 different health conditions. This ensures members receive a tailored support. WebMD focused on providing different engagement methods rather than an all-encompassing coaching experience. And then lastly, financial. We found that Virgin Plus, Sonic Boom, and WebMD offered solutions at a more competitive pricing than ShareCare, which had a considerably higher initial cost and annual increases. Lastly, Section F, our recommendation. It is recommended that Virgin Pulse be selected as the LAWell program plan provider for a 3-year contract beginning April 1st of 2024, with an option for up to 2 additional 1-year terms pending successful negotiation. This does include a summary of the presentation, but we're open to any questions you may have.
Oh, go ahead.
I'm just wondering why it's tentatively.
And it shouldn't be. Actually the selection is the selection. So it's I think that was more of a typo. The recommendation should be for a selection of Virgin Pulse, still pending contract negotiations. And I think Siegel also has an analysis they did in attachment B, and I think they wanted to throw in a little bit of their view. But is there any questions you have first?
Steve Murphy from Siegel. Thank you for the opportunity this morning. My colleague Stacy Rossi, who is in our Boston office, struggling with weather. I actually have weather this morning, which is great. But Stacy is our subject matter expert with regard to wellness. She's got a clinical background. And so, Stacy, if you want to jump in and just provide an overarching overview of kind of your analysis of the responses and their alignment with the city's objectives.
Sure. Good morning, everybody. So each vendor did have unique capabilities and strengths, but Virgin Pulse aligned with the city's 4 pillars of wellness, which encompasses physical activity, nutrition, stretch management, and prevention. And that, along with the evaluation criteria, we thought that Virgin Pulse was the best choice out of all the bidders.
And then, so I'm wondering about the criteria for having the gross annual revenues of at least 15 million. Is that just making sure that the company is going to be around
Yes,
for
that's
longer
correct.
time?
And you may be interested in looking at Siegel's analysis in attachment B. It does do a side-by-side of all 4 companies, the services they're providing, and the cost associated with it. The committee may remember when in current day, the provider is providing just really I'm losing my train of thought right now, an incentive program. And so the objective of the RFP was to go out and expand the services of this wellness program. And So a lot of the services that are proposed here, the health coaching, those identified items are, and in addition to what is, or an added feature than what we are currently providing. I'm not sure if Daniel, if you wanted to say anything else.
No, just to keep it on it, and it's, all these providers, I think when we were reading these proposals represented an improvement in existing services. So I think, kind of no matter which way we went, we thought we were gonna get a better product for employees. But, Virgin Pulse was clearly to us the best fit. While they all seem capable, just kind of across the board in each rating section, they seem to take a little bit of an edge, against the other proposers. So, a lot of good news services that would come toward the employees, and especially when it comes to health, the wellness, and the lifestyle coaching, which is something we just don't offer right now. We can see that being a really big plus for employees.
Daniel, if I could add on to that, I think one of the important features is a lot of these organizations typically work with very large self-funded employers. So they kind of have access to everything. City's unique in that it has relationships with both Kaiser and Anthem on a fully insured basis. So when you kind of start rolling back or peeling back the layers, Anthem and Kaiser are really responsible for kind of the care management aspect of it. So again, we're asking these new partners or partners to work in tandem with Anthem and Kaiser. So doing coaching kind of outside kind of the medical plan, but also being that first referral back into the system so the member can get the appropriate medical care and resources through the plan that they're affiliated with and the city is already paying for. So kind of understanding that dynamic was also one of the elements of trying to figure out who could truly work with kind of fully insured partners and do it effectively as opposed to, having worked with them, but on a different basis. So there's another reason why Virgin kind of rose to the top in our assessment.
I think if I can ask a question about specifically the coordination, just because since you've provided nice scores, the Virgin evaluation has kind of one concern area where they're basically the top, and that's the coordination with other vendors. We're confident that even though that's not their core experience, they'll be able to coordinate with Anthem, Kaiser, and get everything in line with the seats.
It's going to need to be, because again, we're not going to be asking Virgin to do everything. And we're already kind of leveraging those resources or purchasing those resources through Anthem and Kaiser. So the intent is to work in contact or parallel. And so, I guess the best way I would put it would be kind of just in time, right? So if a member is newly diagnosed with diabetes, they may come to it through Virgin Pulse in this case, where it's like, I was just diagnosed, what do I do? The coaching can begin at that point, but there should also be a soft referral back into their appropriate health plan to make sure that they're getting those resources as well. So there should be a lot of things working in tandem at the same time.
I know that's currently one of the kind of rough spots in the bridge between healthcare and wellness is going back and forth. You need something in one of them, you're in the other one, to be hard.
The intent is not to have them compete against one another, that's for sure.
Yeah, I think for any of these, I wouldn't describe that coordination as like plug and play. It's going to require a lot of staff involvement, staff coordination, working with all the account management teams, the health carriers and the wellness provider. I think that'll be a long-term ongoing, how can we keep improving on that coordination?
I'll also add in, so this one was a little different from the RFP we've done in the recent past, as in we were asking for anything and everything through this proposal. So the contract negotiation step next is going to be really where we iron down what this is going to look like from a scope of services standpoint versus what they proposed and what we're actually agreeing to do. So that piece, coordination, is definitely a high one for us to discuss out through contract negotiation. You had a question?
And so I'm looking at the chart, and there just seems to be so much more information under Sonic Boom, and yet we're going with Virgin Pulse. Is there any chance that we're gonna run into negotiations with Virgin Pulse and find out that they just don't have as much going as Sonic Boom?
So what I can say, and Steve and Daniel, you can chime in, we have to go off of what they answer on a questionnaire. Just what is written as a response, not anything we know about a company outside. In the overall questionnaire, Sonic Boom did not really give as much information, did not perform as well as far as answering a lot of the service questions, and that's why they're scoring it up the way it does. To answer a little bit more to your question, in the process of executing the contract, if the contract does not work out, if we're unable to get to a mutual terms in going through negotiations with Virgin Pulse, then we would go back to the next highest bidder. And we discussed that back with the committee before we move forward as well.
I'm gonna ask Stacy to see if she can comment too. I think your question was looking at the overall scoring. Sonic Boom certainly seems to be as a potentially good partner. So are we gonna perhaps have buyer's remorse down the road if we can't kind of reconcile these or do it? So Stacy, I'm wondering if you can provide some context on your interpretation of kind of the responses, but also maybe color that with some of your experience with other accounts and other experiences with these different vendors.
Sure. I mean, again, it was very close across the board, but when you go into the individual questions that I believe are attached, Sonic Boom did not, as Paul mentioned, their answers weren't as robust, particularly in their web platform and their outreach and member engagement. So I think as you dig into the answers in more detail, you'll see those differentiators throughout the RFP and the answers.
I think the outreach and engagement is going to be a critical factor regardless of who we select. I think that was probably one of the shortcomings of the current program, which is kind of it existed kind of statically and was not really kind of engaging or doing outreach. And so again, the intent is to have partnerships between the vendors, the wellness and healthcare vendors, to make sure that we're reaching members as much as possible and capturing them at that right time so that we can engage them in making positive behavioral change.
Would there be turnover in providers to the extent that people are working with folks in the current wellness provider? With this change, is it going to push people? Are people going to have to find somebody else to work with? Is that kind of like when we switch healthcare? Sometimes your doctor drops and you have to find a new one for it. Is that going to happen in this case?
No, because right now we don't even have the health or wellness coaching. So the employees don't have a relationship with anyone with the current vendor. But you're right, that wouldn't be a concern if we already have that service and they're making this change.
I noticed that Virgin Pulse is one of the higher cost options. Could you speak to that a little bit and kind of the cost benefit, what outweighs that?
Stacy, I think the question was the cost differential for Virgin Plus versus some of the alternatives, and I suspect you may want to kind of provide a little more insight into kind of the coaching aspect of it.
Yeah, so I mean, I think that Virgin Pulse is a little bit, I'm sorry, I'm trying to pull it up, but not a lot more than the other vendors, but their coaching model is they're nationally board certified. Coaching is definitely a clinical component of their philosophy, as well as what we talked about before, the outreach and engagement definitely goes beyond the other bidders when you read the responses. The other thing I'll add is the triage. I think that was brought up before. Their referral process and their triage to members when they do call in, and it might not necessarily be the program that they offer. They are strong in coordinating that with the other health plan vendors. So some of those things, stood out to us as we're looking at the pricing model and the services.
I think I would add, because all these proposals that come in, they structure their pricing a little bit differently. I don't think Virgin Pulse is that far removed from WebMD's and Sonic Boom's proposals.
Yeah, they were close.
Sonic Boom looks a little bit cheaper, but then they kind of broke out some separate costs. Like there's a separate cost for the coaching, which wasn't part of their base proposal, and a separate cost for each additional wellness coordinator, the on-site staff. Whereas the Virgin Pulse proposal included all that within the top line number.
Am I correct that the Sonic Boom one, because they identified the extra cost in the total or the separated out cost for wellness, but they also have an additional line there about additional wellness. So I'm assuming that maybe they have a certain amount for that 180 plus if you go over, or why do they have that?
Yeah, I believe that's it. You're referring to there's a certain volume of calls
Yeah.
or what they're anticipating or even additional
Yeah.
cost per call. Yeah, that's right.
Yeah, they have a minimum of, it's 250 calls and then after that, they would adjust it.
And this was more of a curiosity question. Do we have an idea why wellness apparently didn't take the time to do this right? And I'm not saying I'm a fan of them, I'm just
Oh,
curious.
you mean the incumbent provider?
Yeah,
Yeah, sometimes, I mean, this is happens, sometimes vendors just miss deadlines. And that's just what happened here.
To their benefit or credit, I would say, the program was launched right on the precipice of the COVID pandemic, and so when everything was kind of geared towards in-person, on-site events, and we were all kind of living in that world, and then when the pandemic hit, it's almost like we didn't have an oar in the water at that point. It's kind of what are we supposed to do? And I think we're trying to take that into account to go forward in what is probably more likely to be a hybrid environment as we extend forward. So
Right.
doing both in person, but also having the ability to coach virtually and do a variety of other things.
Can you also talk about, the credit where they have different options that are provided for engagement and for communications?
You know, like the incentives, the rewards.
Yeah.
That we still have to iron out. So every vendor, every proposal had a lot of options. And much beyond what we're doing now, but there's just a lot of nitty gritty for us to work through in the negotiation process. And not so much what the vendors can do, but what the city can do and tax reporting and all that kind of stuff. But that's definitely one of the more promising improvements coming up.
Again, in terms of engagement, I think one of the areas that probably was an obstacle for the original program was again the lack of financial incentives and other things that other organizations use. And again, to Daniel's point, administratively, they were very difficult to administer and do properly. And again, so as these RFPs went out, the inquiry was actually in an environment that might rely very little on incentives. How are you going to have an impact? So we were hoping that by kind of selecting the right partner, even without incentives, we should be able to get, progress compared to where we are today. And if that environment or dynamic should change, that might only accelerate progress we can make.
From a personnel department standpoint, how much of a lift is it gonna be to do the transition?
Well, I would say because to the points made earlier, the current program is just the incentive program. This transition seems to be like it might be any easier. Once we get the fine-tuned negotiation of what the services really look like and what we want to commit to. I think it should be a somewhat easy transition for employees to realize in making the new system go live and launching those services. And it should be an easy transition from one system to another administratively. The biggest tackle with everything is the same thing here. It's going to be education. It's going to be informing employees of these new services that are available, trying to get them excited, and making sure that the services meet their expectation when they receive them. We really want them to go towards those health coaching services.
Any more questions or? Do you want to move forward with the motion?
I would move the staff recommendation on the report.
Okay, with the motion in front, we'll go ahead and do a roll call vote in the same order as the agenda. So starting with Shauna. Shauna, your vote?
Aye.
Shauna votes aye. David, your vote?
Aye.
David votes aye. Jose, your vote?
Aye.
Jose votes aye. Esteban, your vote?
Aye.
Esteban votes aye. Lisa, your vote?
Aye.
Lisa votes aye. Tyrone, your vote?
Aye.
Tyrone votes aye. Matt, your vote?
Aye.
Matt votes aye. Paul, your vote?
Aye.
Paul votes aye. And Petty, your vote?
Aye.
Petty votes aye. It's unanimous. The motion passes.
So moving on to committee report 2239 and
So this is a committee report this is a report to the committee from the medical ad hoc subcommittee. So a few meetings ago, the JLMBC might remember that we created medical plans subcommittee, specifically to look at the high cost of medical, everything that's happening as far as premiums continuing to increase, and looking and reviewing further of what kind of changes we can as a group consider in trying to combat some of the overall high costs that we continue to see. You might know that our plan structure has remained the same plan structure for well over a decade, for quite a long time. We have not changed anything, no copays and deductibles, nothing at all with services. So really the subcommittee's, objective is to look at everything and make some decisions on how to move forward, or to make a recommendation to continue the current contract with no change. So in this report is a summary of what they've discussed so far. The committee's objective, the subcommittee's objective, when they were created, is to make a final recommendation. This is not a recommendation of actually going out to RFP or going to contract. This is currently a recommendation to do some more review, do some more design leading up to making that decision. So the subcommittee is not done. They still have a lot of work. But this is what they were reviewing so far. On page 2, the subcommittee has identified the following 16, I believe, items for consideration and further development. All broken into a couple of different categories. So looking into changes of the plan, looking into making another dependent eligibility audit, to looking at potentially changing cash in lieu incentives, to changing eligibility rules. And then the second section that's in blue there is changes to benefit plan design. And that's really what this report is about. So looking into changing the medical plan design, or adding a new plan, or weighing the importance of provider loss, which is something that we just talked about, of how important it is for employees to be able to continue the same access to the same doctor, unbundling versus bundling, a lot of other changes. And in addition, they're looking at fiscal changes, capitation audits, pooling point audits, analysis, and then some other wellness things. So there's a lot still to discuss. But in discussing with the subcommittee and with the consultant Keenan, this middle section here, items 5 through 11, seem to be the area where the most change potentially could happen as far as cost savings go. By looking at alternatives, by looking at other options into what we can request for medical plans, seems to be the biggest dynamic. But in that topic, in that conversation, we need to understand from the employees where to draw the line on what changes to make, what their receptiveness is towards having an HDHP, a high deductible health plan, what their receptiveness is to changing a copay, changing a deductible, not being able to see the same doctor that they're seeing now. We need to understand kind of what their feelings are, what their attitudes are towards those types of changes to be able to design this as an RFP. And then only through issuing the RFP will we be able to understand what the cost savings could be. There's a lot of reports and information that Keenan had provided showing that there could be a substantial cost savings of a few millions of dollars if we did move to include an HCHP, another plan, or even change our deductible and copay amounts. But we're not going to know what that actually is for us unless we issue an RFP and see those responses back. So this report itself, and there's a lot more information in here, and there's a whole slide deck of everything that Keenan has provided for support on looking at items, is really just a recommendation for us to start the design process of an RFP and further look into all of those items to see where employees feel comfortable with making a change towards their current healthcare. That would be us going out and performing surveys, focus groups, trying to get general opinions, looking at data, actual use versus kind of what's happening over the structure of the plan on those different plan items to really identify where we think a tangible and receptive change could be. The timeline for that conversation is further in section C of this report. I lied, it's in section D. So we would be using this time period now immediately after discussion with this committee. We would, assuming that the recommendation would be to approve to move forward and continue with the design, we would be immediately moving into executing surveys and discussion items with focus groups to gain that information from employees and build into that conversation. We would need to, if the subcommittee chooses to move forward with releasing an RFP, that would need to happen by February. So we would bring a draft back where the subcommittee would make a new recommendation, a formal recommendation, while they're still looking into all the other items on that 16-item list. They would move another recommendation in February to the full JLMBC on whether or not to issue the RFP. If that recommendation was to issue the RFP, we would have a couple months to be able to do so. That is the same timeline on page 5 that we do in a normal cycle. We are unable for medical RFPs to really get responses due back before March or April because of the nature of how health plan providers need to cost out the services. They do it based on plan use of the prior year. And it takes them a while to be able to, for that data to be available. And then because the plan must be adopted by council before we move forward with open enrollment, the objective is to make sure that we're selecting somebody or whatever those health plan providers are by June at the very, very latest, so that council can adopt immediately in the beginning of the fiscal year. If the recommendation is to not, if the findings of the subcommittee found out that, well, actually, this is not really going to be viable, or there's not an interest now to move forward with an RFP, the timeline to execute an extension of the current contract matches up a little bit with that current timeline. So by February, we would need to start negotiations of that contract extension for the renewal process, which would happen on a regular basis in April through June.
One of the things that's been mentioned in the points here, and this is mostly experience in a couple of other units that I have. The idea that what's the tolerance for potentially changing healthcare provider, which I find for most of our members is probably one of the, we'll figure out what the survey says, but I'm going to predict the answer. No, I know, for example, in one of my South school districts, this actually didn't have anything to do with change of providers, but in the dental plan, a lot of providers ended up not being picked up. It's kind of like when Disney Channel loses ESPN. And so my question is what do we know about the current provider and whether or not the current provider we have and whether or not they'll still have? I think it's one of the most critical questions for most families. Can I keep my doctor? And we hear it loudly when we can't. So I know that we're looking at it in terms of if we change the overall, how do we get it? But what's our idea about whether or not if we did an extension, we might not be experiencing that anyway, because there appears to be, at least in some areas of healthcare, that, I hate to put it, but that Disney ESPN phenomenon, which is a bit of a problem, which we can't then do anything about.
So I'm not sure, Borden, if you wanted to say anything to this as well. Borden is from Keenan.
Okay.
But if I think I understand the question correctly, if we were to move forward with a contract extension, it is just status quo essentially. We go through renewal each time. But if you were to move forward with an RFP selection, we would be wanting to ask for a lot of different variables. So we'd be asking for replacing the current same exact product, option A, option B, option 3, all those other ones.
Right. I understand that part of it, but I guess my deal is that in looking at whether or not we might change to get a cost savings, the issue comes up. I still think it's an important one. What do we know about I don't want to assume that just because we extend, all of our doctors will remain the same, because my experience has been that a lot of healthcare providers, whether these organizations, are finding they're losing ESPN for contractual discussion. So what do we know about that question with our existing group that we might be this extending on that?
Well, I think if I still understand it correctly, that is always a concern, right? The contracts, and as you see, as the committee sees, we see contract terminations on a routine basis regularly. It's constantly evolving.
Right.
I don't think there's anything necessarily that we would be able to say to be able to address that. There's not, from my understanding, a health provider that would be able to guarantee a certain level or
that. I'm just thinking, what is our experience over time? Because it's listed as a factor for the possible change. And my thought is it may just be a factor even if we keep the people we have.
Right. Oh no, yeah. Okay, I think I understand. So So I think that the biggest part of that factor is just employees understanding, what their options are. I think if there's,
I'm sorry to cut you off, but it's not that. But, so all of our employees, all of our members, whether I like it or not, want to keep going to the same doctor, the same dentist they have. And I guess the question is, do we have some idea of what is the volatility in people being able to keep their same position within these structures or a new structure? That
no, I don't, well, Gordon, do you?
Yeah, I can address that. And it currently is a little bit different in the dental field right now.
Right.
Specifically with Delta Dental.
exactly.
They're due to multiple networks and contracting that they're doing, there is some disruption. And it's just a phenomena of the industry right now. There's a lot of dentists retiring and others are leaving the state.
Wow.
So those are so that kind of addresses that. We try to be as sensitive as we can be relative to member disruption.
Right.
So part of the RFP process is looking at how well we can capture from our existing carriers, their current providers, the facilities they're going to, and seeing what kind of a match that is for any alternative that we would be looking at as well too. Relative to the guarantee that that provider will continue to be there. All the medical carriers, they're negotiating with various different healthcare organizations, whether it's the UC system or anybody else. It's on a rotational basis. Typically, those contracts are renewed. Sometimes they go to the deadline and beyond. And we're hopeful that those are resolved with their current providers intact. What we don't have control over is the decision of the individual providers that they would simply retire or leave that particular provider.
Okay, thank you. Thanks. And thanks for the other.
I have a question about your timing chart on page 3, comparing contract extension versus RFP execution timeline. At the bottom of the chart, in August, September, and October, there's discussion and negotiation contract extension terms. Did that work happen? Are we on that schedule?
You said on page 3?
The chart where you on the top page, so I guess item B, the timeline chart.
Oh, I think you're looking at the previous one. So the report is pages 1 through 5, and then there's attachment of the previous report that we brought to committee. And that timeline was a different perspective timeline.
Okay.
So that one was
So the current timeline was on page 5.
correct. So the new timeline for this objective is on page 5 of the first report.
On the old timeline, this would have been the month that we would have awarded the contract extension
Yes.
and work
And-
time.
So that original conversation was, should we move forward with just doing a contract extension, or should we create the subcommittee to look into doing something different?
Okay.
And so we created, and the result of that conversation was to create the subcommittee and so look into it further before deciding on moving forward with the contract extension. So now, the deadline is still the deadline. We have to have a provider in place for 2025 by June of 2024. So working backward from that deadline, that's where the timeline on page 5, based off what our objective is, what the matters at hand, really play out for us to be able to work with.
I guess my question still stands. Did the work of negotiating, discussing and negotiating contract extension terms happen?
Those are options, and that did not happen. We have not done any discussion at all with either of the healthcare providers on contract extensions at this time.
With the goal, with the items that you've identified, the possible things to look at for changes that would be would require changes, impactful changes to the RFP. Would the goal be to answer those questions on the city side and then put the answers in RFP and have the providers propose costs on them? Or would the goal be to kind of ask the questions in the RFP and have the providers come back with options or recommendations? It's sort of a different, I guess the short question is, do we want to answer the question or are we gonna ask?
I think the discussion of design is right now to ask as many options as possible. So from that point, we're asking the providers the questions. But for what we're asking, developing that from what we're receiving, what we're identifying, that part we wouldn't necessarily tell the providers that this is the answers that we got from our groups or from our employees. We would just craft it as this is the objectives that we're looking for. These are the plan options that we're looking for. And how would they respond to those? How can they provide those levels of service? What does it look like? It is a lot. It is a lot to comprehend because there's a lot to look at as well. If it does kind of make it easier to understand, this recommendation is really a recommendation just to take one step, essentially a non-commitment recommendation for us to look things further before actually taking any action whatsoever. So if the committee agrees with the recommendation today, there would be no change to current services and no change to future services yet at this time.
So the surveying and the focus groups is city work. We're not
Correct.
doing an RFP for.
Oh, no. Yeah, no, that would be us. It would be staff and consultants creating that, reaching out to people, trying to get that information. It wouldn't be an outside service. We did do that in 2015, I think, or it was the last time we've actually done those kind of services or exercises, maybe is a better word. So we have history of doing it. It's just been a while.
Just to clarify on the recommendation and looking at the timeline, the recommendation says, recommendation B is to develop the RFP.
Correct.
And then in our timeline, the subcommittee is gonna come back to us
By February.
in February with a recommendation on whether to release that RFP. So your plan would be to start work, probably already started work on this RFP, and sort of roll that in to be ready if the subcommittee recommends to do it, and if not, we'll just set that draft RFP aside for next time and go on with contract negotiations.
That's a pretty good synopsis. We would be, and as there's another report on procurements later on, we're pretty much going to be using the same kind of template RFP that we have. The real work is just, defining that middle section of the scope of services, kind of what are these different things that we're asking for and how does the questionnaire play out? So it's still a lot of work though. It is still a substantial amount of work to try to pull together in a few months. Any other questions?
If no more questions, we have a motion from the body.
I'll move it, go ahead.
I was gonna move, but
You don't have a mic.
I feel conflicted. Oh, that's true.
Was there a motion?
There's a motion. Do we have a second?
To adopt the recommendation.
Second.
So the motion is for A and B, correct?
Yes.
Okay, with a motion for both, we'll go in the same order. So Shauna, your vote?
Aye.
Shauna votes aye. David, your vote?
Aye.
David votes aye. Jose, your vote?
Aye.
Jose votes aye. Esteban, your vote?
Aye.
Esteban votes aye. Lisa, your vote?
Aye.
I'll take that as an aye. Lisa votes aye. Tyrone, your vote?
Just trying to stuff the ballot box.
Tyrone votes aye. Matt, your vote?
Aye.
Matt votes aye. Paul, your vote?
Aye.
Paul votes aye. And Petty, your vote?
Aye.
Petty votes aye. It's unanimous. The motion passes.
you. Here we go, okay. Moving on to individual items, presentation from Delta Dental.
Good morning. Can everybody hear me okay?
Yes.
Wonderful. Well, thank you so much.
Sorry, thanks, Michelle. Before we jump into your presentation, we're going to do a brief intro with a couple of slides just kind of reviewing service and experience with Delta before we dive into the 2022 plan review. All right. So as a starting point, we're going to take a look at the program renewal overview on the next slide. And essentially just a reminder, we just went through that RFP this past spring, and Delta was awarded a 3-year contract with 2 additional 1-year terms. With that program RFP, we did get attain some good rate savings based upon the experience and quotes that were provided by Delta. Firstly, on the HMO, 5% rate decrease for the 2024 plan renewal, and that rate is guaranteed for the 5-year contract available terms. On the PPO and preventative, both had a 2% rate decrease, effective for that 3-year initial term of the contract. And some additional history on the plan rates previous to the recent renewal and RFP process are detailed as well. All right, thank you. Just looking at the participation utilization overview, a small decrease in overall plan enrollment and utilization increased only a little bit compared to 2021. We look at the plan design. You have that diagnostic and preventative waiver is a great feature of the program, so it doesn't take those dollars out of the annual maximum benefit amount. And it looks like, you know, the LA employees are utilizing at least 1 cleaning and a little bit higher than Delta's municipal benchmark. And looking at overall online engagement, we did see there was an increase in online activity and utilization of different cost saving estimate requests. So a little bit more employee engagement online, but again, can always increase. And, you know, Delta's resources and access to these different resources are highlighted in the employee open enrollment and benefit communications available on the JLMBC website. And now passing it off to Michelle. Thanks, Michelle.
Wonderful. Thanks, Megan. Good morning, and thank you for the opportunity to be here today. I appreciate it. My name is Michelle Bodie, Director of National Account Management here at Delta Dental. Today, we are going to review the 2022 plan performance for dental. And just a few key insights. I won't go over what Megan just reiterated, but these are some of the highlights that we'll be talking through today. Financial overview. We'll take a look at the plan performance and then website utilization as well as member resources. 2022 plan enrollment by plan. As you can see, there's been a slight decrease in enrollment overall, decrease in enrollment for all 3 plans of 1.32%. PPO year over year, we saw about a 1.4% decline. In the preventative care plan, 8.8% decline, which shouldn't be too alarming because as you can see there, the enrollment is much smaller. It went from 501 enrollees to 457. And then Delta Care USA, which is our DHMO product, remained fairly consistent with a less than 1% enrollment change. And then below, you'll see the average age of employees per plan. PPO average age of 48, which is right in line with our benchmark. Preventative plan 47, and then Delta Care we saw slightly lower average age of 43. Financial overview. The total plan costs were 94.1% of premium in the 2022 plan year versus 93.6% in 2021. As you can see there, the incurred per employee per month rate remained pretty consistent. And then at the bottom, it shows quarter by quarter, and you'll see spikes in Q1 as well as Q4, which is pretty consistent not only with the city of LA, but with our book of business as well. Traditionally, people go in at the beginning of the year when they have a fresh start on accumulators, and then at the end of the year to utilize FSA dollars, for example. Network utilization, I'm very pleased to report that 94% of approved procedures were performed by an in-network dentist in the current plan year, which is outstanding. And then you'll see pretty much consistency here year over year. The orange represents the 2022 plan year and the blue is 2021 versus our benchmark in green. You'll see consistently 71% of the procedures were performed by a PPO provider, 23% by Premier, and then 6% out of network, which is lower than our book of business. So congratulations to all of you in the room. Certainly you're doing an excellent job of promoting the value of seeing a PPO provider, because these are outstanding statistics. Provider discounts. The city of LA is recognizing over 13.6 million in savings from provider discounts, which again is outstanding. Over 40% discount from PPO providers, 21% for Premier providers, which equates to a 33% net effective discount. So again, this is a result of the great work and in partnership that we're doing together with contracting with providers. Distribution of services, and this is outlined in percentage of approved procedures, very similarly to the pattern we've seen on the previous slides. For the PPO, 72% of approved procedures happened in diagnostic and preventative care services, which are your exams and your cleanings. 23% consistently year over year for basic services, which are your cavities, for example, and then consistently 5% for major services, which are more of the costly procedures such as crowns and inlays. Over to the right, Delta Care USA, which is our DHMO product. Good news is we did see a slight increase in diagnostic and preventative utilization, which is exactly what we do want to see. Basic services went down about 3%, and then major services went down about 1%. Again, this could be equated to the decrease in enrollment in the Delta Care, but nothing too alarming here. Diagnostic and preventative services, 56% of members had their teeth cleaned in 2022 versus 86% of utilizers received at least one cleaning last year. And then 35% of active members did not utilize their dental benefits in 2022. So if there was an area for us to focus on, we could certainly talk about different ways of promoting the dental benefits and in the value of oral health care. Down towards the bottom, 59.3% of members had an exam in 2022, so consistent with the cleanings. Often when you're getting a cleaning, you're getting an exam at the same time. And then 91% of utilizers received at least one exam. Annual maximum, 4.2% of your members reached the annual maximum last year. And this really talks about, and we look at this each year, just to make sure that you're in line with other municipalities as far as your $1,500 annual max. And if you're receiving questions about should we increase or should we decrease the annual max, this is a good illustration to help gauge that. So with only 4.2% of the members reaching the annual maximum, I would say you're in a pretty good place. Over to the right, it shows how you compare to other municipalities in our book of business. And just over 22% of groups have that same 1,500 annual max. Slightly more have a 2,000 annual max, just over 25%. But again, I would say you're in a good spot here. And then towards the bottom, it shows really where the dollars lie. Over 14,000 of your utilizers are receiving services under $300, which again, it is in line with the diagnostic and preventative procedures that we saw on the previous slide. Only 4,826 utilizers reached that 1,500 annual max. Ortho utilization, 6.3% of child dependents utilized ortho in the current year. And then again, if you want to look at the benchmark, 44.6% of our clients do have child-only ortho. So you're right in line there again. And at the bottom, it shows what that maximum is. Let's talk a little bit about web engagement. The good news is 44% of active members have enrolled in Delta Dental Online and created an online account, which is good news. And even better news is 66% of those members did sign up for paperless EOBs, which again is what we want to see. And we did see an increase year over year from 2021, up from just shy of 30%, which is good. So again, well done to everybody in the room with really promoting the value of online engagement. And then just an outline of who visited the website and why they visited the website. 4,589 unique website visitors in 2022. What did they look at? The majority of those folks, 30%, looked at claims, which is standardly the highest trafficked area. 2% looked at their benefits, and 12% pulled up their ID card. And that could be to print it out, it could be to add it to their Apple Wallet, things of that nature. Another positive statistic is we did see an increase in the number of cost estimator requests. 459 cost estimator requests and 138 unique users. This is an increase up from 216 from the prior year. And then just a reminder of what cost estimator is. Next slide, please. Wonderful, thank you. As a reminder, cost estimator is exactly as it sounds. If any of the City of LA members want to gauge or budget for their dental costs, they can put in the service they want to render. For example, I want to go in and have a crown, put in the zip code, and if you're logged into your portal, it'll actually show the employee accumulators and the employee cost as well, illustrating deductibles and co-insurance. So great resource if again, you want to budget or price shop within providers in different areas. So pleased to see that this is being utilized and more folks are utilizing it year over year. Member perks. These are just some of the great perks that City of LA employees have today at their disposal. BrushSmart is our online oral health care vendor where you can get some really great discounts on electric toothbrushes and different oral health care products. We also have discounts on hearing aids and LASIK through our partners Amplifon and QualSight. Our newest partner relationship is with Life Perks, and this offers discounts outside of oral health care, such as discounts to amusement parks, for example, Disneyland. I actually utilized it for discounts off of a laptop for a family member. So again, great resources that your members can tap into. And then lastly, virtual dentistry. always an option if you're short on time, or if perhaps you're traveling and have a toothache. Virtual dentistry is always an option, similar to what you're utilizing today with your medical carrier. You just go online, schedule that appointment, and then log in about 15 minutes prior to the appointment, and you've got the dentist able to speak to you. And then we've got some great video resources available at your disposal. If some of your members maybe want to learn a little bit more about the difference between PPO versus Premier, or if they want to learn more about Cost Estimator tool and how that can help them, we've got a lot of really great tools that help make it easy for your members. And then lastly, as a nonprofit, it's very important to us to give back to the community. These are just a few examples of different ways that we're giving back right here in California. And this is through our Delta Dental Care Foundation, which is our philanthropic arm. We've partnered and given back to Clinic by the Bay in Northern California to help meet the growing needs of free healthcare for people in the Bay Area. We've also partnered with Healthy Smiles for Kids in Orange County. This is the largest provider of oral health care for underserved children in California. And then we partnered with Redwoods Rural for our senior population. So again, just to name a few ways that we're committed to giving back. And that is all that I had. I'm open to answering any questions, but certainly appreciate your time today.
Hi, I just wanted to ask for the perks and the online video tools that you have. How are members notified or aware that those exist if they currently don't go online for any services?
Sure, they are on our Delta Dental website, but if you'd like marketing materials that help promote it, we can certainly do that as well to post on your site as well.
That's the main thing about it. I just think the average, well, I don't know what the average person does. I know personally I've never gone online for Delta Dental services, but I'm interested in the perks and the videos that you mentioned. So I was just wondering if there's, there must be a way to let people know that exists.
Yeah, absolutely. And then the slide, Megan, if you're able to go to the slide with the different perks, there's actually a QR code, and we can send you a material about that electronically as well. That's the easiest way that we find that members utilize, is they just scan that QR code.
Any more questions on this meeting? Thank you so much. All right, on to Committee Report 2340 for procurement updates.
Hi, I'm Isela Jurado, Benefits Analyst with the Employee Benefits Division, and I'll be giving you the update on the status of our RFPs for the 2025 plan year. They include life insurance, disability insurance, AD&D, and tax advantage plans. For each of the solicitations, staff is asking vendors to match the current service design as a baseline of the request. But each RFP will also ask for either alternative benefit designs or benefit enhancements as an option for the city to consider. And I'll give you a brief summary of some of the alternative or service enhancements that staff has determined to request in each RFP. For life insurance, one of the biggest differences this time around is that we are requesting quotes for both term life insurance and whole life insurance. We are also looking to increase the benefit amount for child life insurance, which currently stands at $5,000 coverage. We're aiming to improve the experience for beneficiaries filing claims by identifying options to improve and expedite funeral assignments. Now, for disability insurance, we are looking to increase the supplemental disability plan options aimed at providing a more affordable supplemental benefit insurance option in addition to the current 66 2/3 salary and age 65 plan. And under disability, one of the existing concerns is timing of when benefits become payable for employees who are going through a workers' comp claim and file for disability. Therefore, we are looking into revising when benefits are payable for these employees. For AD&D, we are exploring enhancing the benefit structure by having separate plan levels to match the LAWL levels of employee only, employee and child, employee and spouse, and employee and family. Currently, the levels stand at either employee only or employee and family. And for the tax advantage spending accounts, we want to improve on the file feeds between systems and the resulting action. So we are asking to improve integration between the current and future systems. And for each of these solicitations, we are asking for enhanced education / communication and coordination, aimed at improving the experience for both member and administrative staff experience. There is a tentative release date of January 2024 for these RFPs, with all having a proposal due date of March 1st, 2024. We anticipate having a recommendation for you based on the results at our next meeting in December. So pretty much sums up my brief update for you. We'll be pleased to address any questions you might have. Any questions?
Thank you.
On to report 2041 HR update.
Okay. So this update is our regular update about the HRP program. And the minute that we printed this, it's out of date, right? So, so the good thing about the extension is that we have time to be able to do what exactly this report says is our concern, that we didn't have enough time for the December go live. Now that go live is June, we have more time. It's still our understanding that there's a lot of discussion that needs to happen and a lot of pressure still exists to get things done immediately. So we're in talks right now with ITA, with HRP, the Workday team people, and everybody, just what this testing plan is going to look like for the new change. So I won't bother going through the report all that much since a lot of that information is no longer valid. But happy to talk through anything that you want to talk through with this HRP transition. Our concerns are still our concerns, right? Which is making sure that we are able to test things sufficiently, that we feel confident going into launch. And I think that's the citywide concern, but that is very real for our program.
What was the new go live date?
It's June 16th. I want to say it's the 16th for the first paycheck in July.
Well, of next year.
Correct. Yeah. It sounds like a lot of time, but it really isn't.
Trust us. A lot of time.
You, with the moving schedule and all of the various procurement items that we've already heard about today, obviously moving the procurement schedule around was done to avoid your HRP duplication. As with other departments that have done that, you push it off 6 months and then HRP pushes itself
right
6 months, and now you didn't free up your time. You still have time to do what you need to do on HRP and all the other timelines that you've laid out.
I'll say there is a big concern on being able to do all this work. But now we have a little bit better of an understanding of what this HRP mess is. And I think we have a little bit more narrow of an understanding of what the work is involved. I will bluntly say, we want to be able to do a lot more with HRP, with testing, a lot more involvement so that we can reach that level of comfort. I don't know that negotiations are going to change, or discussions, I should say, with everybody on the team with this testing plan are going to really change all that much of what our testing plan looks like. So what we know about the work involved right now, it is still a lot, but it is it's doable with everything going on. with the procurement schedules, every single employee in my division is on deck, right? So there's nobody that doesn't have their hand in procurement. So it is really spreading us very thin, but we have a goal and we have a plan to be able to take it on. Any other HRP questions? And we'll be bringing back more updates, as I'm sure you're probably sick of hearing updates in other places, but you'll see updates here in meetings to come as far as how this goes.
I know we don't want to think or talk about it, but if there's a additional extension on HRP, is there a point on the calendar at which it'll mess up your implementation with various new providers or?
I don't know, would potentially, well, the one that we just avoided was the scare one, the one that we were advocating not to do, right? So calendar year end is when all benefit changes happen. And so the December 18th go live that they were previously doing was the fear factor that we didn't want to have happen. We actually wanted this. Daniel and I were saying from a long time ago, June 2024 is better for us. So this works out easier. For our side, I know it doesn't work out for controller and tax purposes, but it works out better for us. So if there's an extension again, which I am hearing that's probably, going to be very poorly looked on if it does, but if there's an extension again and it goes back to December of 2024, that's going to bring back our fear factor and our concern on all the changes happening all at once. And that would be for new plan providers coming on in 2025.
I was gonna just, on your comment about, reports and updates, on this particular one, feel free to update us in between meetings if you want to. There are a number of people within the bargaining unit as well as on my chapter board. They have a fear factor no matter when it happens, and looking at implementation of these kinds of things in the area in Southern California, take whatever time we need to make this. So updates on this one anytime. Thanks.
Thank you. Any other questions?
Looking forward to the workshop this afternoon.
Oh, yeah.
Crash full city system.
All right, thank you. So moving on to committee report 23-22 on the self-funded dental vision.
Good morning, JLMBC members. This is Chung, and I will be going over this report. This report is a second update on a prior JLMBC inquiry regarding the possibility of changing from a fully insured insurance plan to a self-funded one for the dental and/or vision plan. Following our prior update from July, where staff discussed the HIPAA compliance mandates, this update is a follow-up regarding the potential costs involved in moving to a self-insurance plan. Now, in addition to the previously discussed resolution change that would be needed, there are estimated costs that would for the additional staff, office changes, and virtual system changes that would be required if we were to move to a self-insurance plan. So for staffing, we believe that a senior benefits analyst one would be best suited for the HIPAA compliance officer duties. Cost for this position is estimated at $231,000 per year and includes both salary as well as indirect costs. For office changes, there is a lot of variability to this. It depends, once we get the HIPAA compliance officer situated and up to speed, depending upon the options they choose, the office changes cost could be as little as $2,000 for minor changes to one existing cubicle, or upwards of $600,000 or more for more substantial changes to the office to the entire. $600,000 for more substantial changes to the entire office. We're currently recommending a budget of $450,000 for this particular item. And lastly, staff is still working with ITA regarding the available options for our virtual systems need, but at a minimum, we anticipate needing about $500 annually for a mail encryption service. And that brings us to the end of this report. I'm happy to answer any questions you may have.
Is there, what's the next steps?
Paul, the next step, we would need to get a budget, we need to add these items to the budget and get these approved before we move into the before we will start working on getting the resolution approved, right?
Correct. So if the objective of the JLMBC is to go forward with the self-funded plans for dental and vision, we would need to get a position first. It is included in the budget package as of right now, although funding isn't identified. So we'd be coming back to JLMBC at some point, possibly to discuss that item. If it continues to be in the budget through the cycle. But that would be the next step. That would be first to get the HIPAA compliance officer position, to fill that position, have that individual go through training, be named as the official HIPAA compliance officer, and then go through that person taking the steps to move us towards the self-funded model with our dental and vision providers, and outline any other changes as identified in this report. So we're talking about a timeline of a couple years, possibly. At least just the position itself wouldn't be added to us until next fiscal year at the soonest.
And Paul, can you remind me the financial benefit to doing that we thought we would realize if we did?
Sure. So right now under our fully insured model, we are sending everything, or all our money goes towards the providers, and they handle all claim adjudication, as well as all services. So in this concept, we would be holding onto that money, and then only transferring the amount needed for claim adjudication. So the services still happen, just the liability and risk comes to us, and we're still holding the funds and able to collect interest on it. As our consultants have identified, it can result in savings of, a couple $1 million over the course of time, within just one contract, just on being able to have more control over finances that way.
Also, because we're in the middle of budgeting right now, so then, I have to think of all these things too for my own department. Do you really think one position is enough for that? Assuming because, if that person goes on vacation or is out or whatever.
Honestly, no, but it is the bare minimum of what we would need to be able to move forward. And to be blunter, I think right now it's hard to get positions added. We still are trying to get some positions added from what we lost in SIP back. So I think it's step one. It is the bare minimum to be able to do this service. Ultimately, there should be more support. And just to say something as well, right? The risk is still the risk. Technically, in this concept, the majority of experience is not going to change. We're still going to be having the insurance provider performing all administrative services. It's just us stepping in when there's a large ticket item or some other dispute maybe that we need to speak on, making sure they're doing everything they're supposed to be doing through contract, which is technically what happens already, just to a different degree. It's more so kind of that liability, the risk liability in managing that, to make sure that we don't have any other issues or problems that occur.
Is there a cost for that risk? Meaning insurance plan of any sort?
Not an insurance plan, not that I'm aware of, but there is in the concept of putting this money into essentially a fund where we're holding resources, we would be identifying as a reserve, making sure that we're able to hold a financial safeguard for addressing that.
It has lots of moving parts that sort of have to rely on each other to do it, but would it be, this is less of a question or a comment, it seems like it would be useful for the consideration of the budget request, have an action by the JLMBC telling the department that this is the direction we want you to go, rather than the JLMBC waiting to see if you get a position.
Mm-hmm.
Since there's no need for a position right now, we haven't told you that we want to do this.
Right.
So it seems like before March, that the JLMBC should have a decision, like an action item that direct you one way or the other. And then if if the JLMBC says this is the direction we want to go in, you guys can tell the mayor and council that. And they can decide whether to give you the resources to follow our recommendation.
Mhm.
And if we don't, then you can tell them that.
I would concur. We'll work on drafting that and bringing it forward.
All right, thank you so much. Moving on to part 2343, activities and projects.
Good morning again. I will also be going over the projects and activities report. First up, moving down over to the project section, we have some updates on the 2023 open enrollment period. Now, in the lead up to and during the open enrollment period, we did several types of print and electronic communication that were sent out to members. The communication topics included enrollment period dates, enrollment instruction, resources, and information on the benefit events that we are holding this year. We also completed a review and update of the member portal and conducted training with the TELUS Benefit Service Center staff prior to open enrollment. Going back to the benefits event, this year we held 4 on-site events throughout the period. The LEL providers provided informational sessions at rotating locations throughout the city. These events were generally successful. We estimated about 50 to 150 employees attending each event. Now, going over to the open enrollment packages, this year we sent over 26,000 open enrollment packages to members. Postage costs for this is about 160,000 this year. But also, as in prior years, we did have a number of packages that were deemed undeliverable by the USPS. So far, about 400 packages have been returned, and we are expecting more in the coming weeks. For those employees who are impacted by this, we have already received some communications from the affected member. We have been advising them on alternative ways on how they could get their enrollment packages. Either they can download a copy of their enrollment package from our website and also from the member portal. We also have paper copies of the enrollment guidebooks available in our office, and we can also mail them a copy as well. But also, we wanted to inform the employees that the packages themselves are not needed for enrollment. They are there to serve as information for the members on what benefits they currently have and what benefits are available that they can choose for the upcoming benefit years. Additionally, when the members are actually, if they're going through the online enrollment process, that module will walk them through the election process, showing them what they currently have, as well as the choices available. So again, the enrollment packages are just informational and not needed in order to actually enroll. Let's see here.
Before we go, so that's the open enrollment. Somebody can ask a question about that.
Sure.
When you're pulling those addresses, where do you pull that address? Why do we, I guess the core question is, why do we have foreign people that have undeliverable addresses?
Our address, well, we obtain our address for the benefit system ultimately from Workday. So currently, employees update or enter their address in Workday. That gets transmitted over to Pacer, and then Pacer sends that information over to our benefit system. So some employees may have moved, they may have changed their address, but they have not updated their address in Workday just yet. And sometimes they have entered in their address incorrectly. So USPS are unable to deliver it if the member did not, for example, put in an apartment number, or if they move and their forwarding request is no longer active. USPS will not deliver it and will return it back to the city. So there are a variety of ways that the USPS can refuse or be unable to process to deliver the packages.
I mean, I think the way you're responding to it is perfect. Basically, you didn't get this in paper, but you don't need it, so it's not to your business. But do you also advise them to go and work if they're at it?
Last year we did, and that's something that we also do this year when we're reaching out to the employees to let them know, about their address issue. We're also going, let them know, where and how they can interact.
Good.
I was maybe ask a question about that too, but I'm stuck personally on the theme of the information. It's not you, it's all the providers, of the information actually getting to the employee. So coming from again, someone that doesn't open that packet at all. Have you, my first question is, have you considered like for the sustainability efforts that the mayor is asking for, et cetera, use that as a goal of maybe not sending them out in the first place? I know it might be a requirement that they have to have it, but, that's one of my questions. Also, because of the workday issues that we're having in my own department, I was wondering, do you have a database of those names of the folks that didn't, the addresses that you've gotten back? Because if you did, and you could sort them by department, and it help the departments, because the departments are on the hook right now to make sure that their employees have all their information correct in workday, and that'd be a good way to know, let's target some of them.
That would be super.
But if you don't, no, I'm just thinking you might have a stack of 400, you don't have. a database.
That is something that we've been looking into and we're trying to mitigate. Unfortunately, there is no easy system currently in place for us to identify those employees. We actually have to manually add those employees to an Excel report and then reach out to them. So
I was wishful thinking.
but it is something we're looking into trying to do. So so far for the 400 employees we did whose packages were returned, we started reaching out to them. So far we reached out to about 120 employees so far, and it's an ongoing process. We're trying to inform them of the issue, and how they can alternative ways they could get their packages. And also to let them know that, the packages are not needed to enroll, and of course, advise them how they can, go about updating their address.
The 160, that was a lot of money.
Yes, it is. And, that, I'm glad you asked that question, because that leads into the next part of this, is that one way we're looking to try to reduce postage costs is to, well, first off, we want to fix the address issues. But secondly, we're also working with the TELUS team at ways we can implement a opt-out feature for electronic delivery. So once open enrollment closes and we have finished our transmitting all the benefit elections into Pacer and onto the LA Well benefits provider, that is going to be one of the top projects that we're going to be looking at working on to have it something that will improve the member experience, and also to reduce costs, for the next open enrollment period.
I have a question, and so I look forward to the printed thing coming every year, but I also look online. Is there, and I did not do my due diligence to see whether or not the information was available before October 1st online. Is it available before October 1st?
Generally, it is. From what I recall, as soon as we begin the process to print those and populate that, first off, they have to be populated in the member's account. So generally, it's available before the member actually receives their packages. So if they happen to enroll, go onto their account, say, September 29th, chances are, their enrollment package and, their personal enrollment guide worksheet, as well as an electronic version of the enrollment guidebook would be there for them to look at and to download.
I'm thinking more about the big book.
Yes.
Because it gets bigger every year, and it's beautiful.
Yes.
But it's a lot. And so we've got the open enrollment period where people actually have to make their decisions. But if we know that information is available because it's gone to the printer, so obviously it was available before. If we could get the guidebook digitally up on, so if we could start absorbing.
Yes. We also make it available on our Keeping LA Well website available as well. So even if the member is having trouble logging onto their website, if they go to our LA Wealth Benefits website, there is a section on resources where we keep copies of all of our open enrollment guidebooks, as well as other, other information, as to the benefit changes that are going to be occurring for 2024. And also, we have information on there, showing employees how to, to log in online and how to go through the enrollment process as well. Thank you. You're welcome. Okay, moving on from, actually, I'm sorry, I do have one more update on open enrollment. The open enrollment period itself just ended on October 31st. So we are currently working with the TELUS team to compile the election information that members have, compile the elections that members have made, so that we can prepare their open enrollment confirmation statements. Now, these confirmation statements, will reflect the members, will reflect the elections that the member made or did not make. So it will allow the employees an opportunity to view their elections and to make one last change or correction if a change wasn't made correctly. And that correction deadline this year is November 17th. So, but as with the open enrollment packages, members don't actually have to wait to receive the open enrollment confirmation letter. I am expecting that we should have soft copies or electronic copies of the letters on the members' benefit account sometime early next week. And moving on over to page 3, we have an update, an ACA update. Now, last year, we had executed a one-year contract with BenefitsGate for ACA reporting services. This contract had the option to extend the contract an additional 2 years through August 2025. And a contract amendment was exercised for this option, and it is currently going through the amendment process now. In the meantime, we are working with BenefitsGate on reviewing the available payroll and benefits data in preparation for the 2023 ACA tax year filing, which is expected to occur on January 31st of 2024. And lastly, we have one staffing update. Unfortunately, Leo Reyes, our wellness program coordinator, recently retired. So we are in the process of working on backfilling his position. And that concludes this report. I'm happy to answer any open enrollment, any additional open enrollment questions or any other questions, any questions about any other items in this report.
I think one comment, regarding the INBC conference, I know we did and I appreciate it, but we did the approvals for that much earlier this year than we have previously. I will say for myself, I still was not sure for the weeks leading up to it if my registration would be processed in time. Because and I did receive, the staff was very good about communicating with me to let me know that that was a possibility, that it might not make it in time. But given that, and I don't know if that's a one-time thing, if that was particular to this year, perhaps we could do it even, I know I just asked for it to be earlier than it was, but now I'm asking for it to even be earlier, just because that process and I don't think there was, delays and things, as soon as we had approved it, the staff got back to us, and I submitted, really quickly after that. And then, so I don't think there was people sitting on things, but I think the process is just such that it takes a significant amount of time. So perhaps we can push it even further. I don't want to do it crazy early, but something where it's not, kind of last minute and a little bit white knuckle. Let's see if it makes it. So, yeah.
Yeah, we can. I was trying to see and remember when we actually brought it forth to JLMBC as approval. I want to say it was June.
I feel like, yeah. So I don't know if it's in January too soon to do it, or
I don't think so, based on how we did it before, because we definitely don't know the cost, per se, at least, well, I think we don't know it. But I think what we did for the change to be able to do it in June was to have essentially the kind of blanket approval, pending the further details. So we could do the same thing, and we could do it earlier in the year. We'll work on creating that and putting it forward.
Thank you. Help with my anxiety. Appreciate it. Were there any other questions on the report? Do we have any requests for future agenda items?
I'm sorry, for future agenda, not necessarily an agenda item, but maybe we can ask when we're getting reports from the various vendors that they include their efforts for marketing that over and above just it's on our website. Not that that's a bad answer, because that's where it should be, but what are the ways to even drive people to know to look at their website? So maybe how they're looking at utilization rates and trying to increase them and increase awareness of what they're providing.
I think so, yeah. Definitely that engagement is super important.
And Delta Dental gave us a report on 2022 statistics. When do we expect to see the 2023 statistics? And I'm only wondering this because I know just during the pandemic that dental services, so in 2020, 2021, 22, they're back on the rise. And I would expect that it would continue to trend up. So is there, can we ask them for a mid-year, January to June 2023?
I think we can. We're actually working on that now. And so the next meeting, the December 7th meeting, is the meeting where the committee is going to take elections again for chair and vice chair in the provisional seats, and where we're going to outline the calendar for 2024. And actually, one of those questions that we're going to ask is if you wanted to continue the presentations as providers are providing them. It sounds like you do, just with some changes as far as the content goes. So we can make an effort on including those proposed dates for each vendor, and we can try to get Delta in the middle.
If there's anything else, all right. So we've got our next meeting December 7th, and then after that, January 4th, we'll adjourn by clock 10:41. Thank you.